Hello dear students and viewers, welcome back with another interesting video lecture. In this lecture, I will discuss an important parasitic disease of cattle. The name of the disease is Stephanofilariasis or Stephanofilarial dermatitis or Humpsore. This lecture has 7 parts. First, I will highlight the causal agent and their morphological features. Later on, I will discuss the life cycle risk factor associated with this disease, followed by pathogenesis and clinical sign of the disease. Finally, I would like to conclude this lecture after discussing the diagnosis and treatment of the disease. If you like this video, put your comments or feedback in the comment section below. Your feedback will be highly appreciated. If you want to get more video lecture on the parasitic diseases of animals, don't forget to subscribe the channel. So let's get started. Stephanofilaria is one of the important genera under the superfamily Filariidae. The major species include Stephanofilaria azamensis, Stephanofilaria stilisi, Stephanofilaria jahiri, Stephanofilaria kelly, etc. The most important species that causes Humpsore is Stephanofilaria azamensis. Cattle are the major host for these parasites. Other animals such as buffalo, goats are also be affected by these parasites. Musset fly, particularly Musca conducens, transmit this parasitic infection from one animal to other animals. That is, musset flies acts as intermediate host for this parasitic infection. Usually, the location of this parasite is in dermis of the final host. So depending on the species, different regions of the body part will be affected. Stephanofilaria azamensis most commonly affect the hump region and its surrounding area. So why hump region? I'll discuss the risk factor of this disease in a moment. Stephanofilaria stilisi infection lesions are found underside of the abdomen, and lesions on the inner side of the ear is found in Stephanofilaria jahiri infection in buffalo. Some species may affect the legs, muzzle, teeth, which are listed here. The distribution of these parasites are in tropical and subtropical regions of the world. Morphological features of Stephanofilaria species. Grossly, the nematode is very small, less than 1 centimeter in length. Microscopically, the mouth opening is surrounded by spiny collar. You can see here the spiny collar or peribuccal prominence around the mouth. Life cycle of Stephanofilaria azamensis or Stephanofilaria species. Life cycle is indirect as there is involvement of intermediate host. Final host are cattle and buffalo. Location of this parasite is in dermis of the final host. Musset fly act as the intermediate host. Infective stage is larval stage 3 or L3 that will be developed in intermediate host, that is in flies. So adult female parasite lay larval stage 1 in the dermis of the final host. L1 is taken up by the flies during taking their meal, that is visiting the host for feeding. Later on, development of L1 to L3 occurs within the flies. It takes around 3 to 4 weeks or more depending on the temperature and other environmental factors. Finally, L3 is deposited in the dermis of the final host during revisit those hosts for feeding. Risk factor, a predisposing factor of Stephanofilariasis or Humpsore. Several factors are associated with the occurrence of this parasitic infection. They are endemicity of the infections, seasons, types of harvest, grazing by the cattle, irrigation on the pasture, anatomical structure of the body, mechanical damage, and poor body condition. All these factors ultimately favors the activities of intermediate host, that is, marsupial flies. According to the literature, the infection rate is around 90% in endemic areas. Next, in summer and rainy season with high rainfall increases the activities of the flies, leading to higher transmission of this parasitic infection. Grazing on the succulent grass produces soft, moisture feces. As a result, more fly will visit the host and transmit the infection. Irrigation on the partial lands also increases the flies' activities. So if there is more moisture on the body, more fly will visit the host for their feeding and ultimately transmit the infection. As I mentioned earlier, lesions are more on the neck region and its surrounding area because there is more moisture in the neck region. It is also due to the increased number of sweat gland and sebaceous gland in this region. Further, the skin is folded here, which also gives more moisture. As a result, fly attack, fly attack is more in this region. Marsupial fly needs moisture like fluid, blood, pus, exudates, etc. as they are male. So due to the mechanical damage in the neck region or any kind of injury on the body or poor body condition will also attract more flies. If those flies are infected, they will release the infective stages to the host body. Pathogenesis of Stephanofilariasis or Humpsore. Flies usually visit the host for their feeding. Initially, there will be development of a small papule on the skin due to fly infestation followed by deposition of L3 stages. These smaller papules will rupture and over the time exudates and blood will be there. This will further attract more flies. As the lesion is itchy in nature, there will be self-inflicted damage followed by secondary bacterial infection. As a result, the lesion will be further aggravated. These smaller lesions will merge together to form a larger ulcerated lesions. It could be even up to 25 centimeter. And ultimately, there will be sloughing of center of the lesions surrounded by dry crust in the periphery. This condition is known as Bermuda's dermatitis or hemorrhagic dermatitis or castado. It is also noted that the lesion extend outwards while the center of the lesion will become hard and covered with thick, dry crust. Clinical signs and lesions associated with Stephanofilariasis or Humpsore. Lesions begin to appear within 2 weeks of infection and they are restricted to the preferred biting site or pre-existed wound on the skin. In Stephanofilaria azamensis, lesion is most commonly found on the hump region, therefore it is called hump sore. Lesions are initially papular in nature. Later on, this lesion becomes exudative hemorrhagic due to rupture of these papules. We have already discussed in the pathogenesis section that center of the lesions will be sloughed off, leaving dry crust in the periphery. It is also noted that in the cooler month of the year, lesions subside but recur during summer and rainy season when fly activity is more. And finally, altogether, there will be production loss. Diagnosis and treatment of Stephanofilariasis or Humpsore. For the diagnosis, we have to first consider the risk factor or epidemiological factor that we have already been discussed. Lesions in the hump region is diagnostic, which is exudative and hemorrhagic in nature. The center of the lesions will slough off, leaving thick dry crust in the margin. Laboratory diagnosis include examination of deep skin scraping, which may reveal microfilaria or larval stages. Organophosphate compound is used for the treatment of Stephanofilariasis or Humpsore. First, it is required to clean up the lesions, and dichlorophon mixed with petroleum jelly or castor oil should be applied to the lesion daily for 7 days. Other organophosphate insecticide can also be used locally. Broad-spectrum anthelmintics can be used to kill the worms, and depending on the severity of the lesions, topical application of antibiotic can also be suggested. These are the references that I have used to prepare this presentation. If you like this video, please subscribe the channel to get more video lecture on parasite of animals. Thank you for watching this video and good luck for your study.